I'm Cathy Fitzgerald. I'm a head of service in the public health team in Warrington Borough Council. I've got strategic responsibility for drugs and alcohol and gambling. So all things that might be classed as addictions come through my doorway and come into my inbox. I've also got responsibility for safeguarding children and adults on behalf of public health. And I've also got a responsibility from a public health perspective around domestic abuse and homelessness. So quite a big tranche of work to deal with. I've been in Warrington nearly 11 years doing this job within the council in public health. And prior to that I was 18 years in Knowsley Council, 10 of which I was leading on substance misuse.
How did you get started in a career within substance misuse services?
It was an accident, I think that would be fair to say. It wasn't certainly anything I'd planned on. My first degree is in social sciences, so I had an understanding of where drugs and alcohol fit into the agenda and to people's lives. I was an area manager of a community and youth service in Knowsley, and at the time, in the back end of the 90s, Tony Blair, when he first came into government, produced a white paper called Tackling Drugs to Build a Better Britain. And that was about how partnership working needs to happen to change the behaviour around drug and alcohol usage. Because what was happening before that was the government would give the police money to put doors in, and then they give schools money to do school drug education, and then they give the health service some money to help people get better. But nobody was talking to each other on a local level. So the white paper that Tony Blair introduced was about having strategic people around the table to come together to start talking about prioritising drugs, it was at the time. So I was put originally on a 15-month secondment in Knowsley to develop a strategic partnership around drugs at the time, and then which then included alcohol, but also to in the back end of the 90s, the funding that came to commission the drug and alcohol services came through the health authorities for St Helens and Knowsley. So my job was to broker that conversation with St Helens to ask for Knowsley's money back. So I had two key tasks, and 20 years on, I'm still doing the job. Obviously with a lot more knowledge than I had probably in 1998, as I had at the time.
What services do Warrington Council offer for young people suffering drug misuse?
I commission a range of services for young people. I think it's about how you define young people. I think that's the key bit for me. So are we talking, I'm just thinking aloud, under 18s, under 25s perhaps. So we have two designated particular areas of work. The under 18s, we've got a specialist young person service that we commission through the council. So across Cheshire and Merseyside, it's the only authority where that service is in the council. Some councils commission that out to other partners. So within that they have a specialist service and also offer a wrap-around service of early help and risky behaviours, because I think what's quite clear for young people, probably up to 2021 maybe, is that people just don't take drugs or alcohol. Some of them have got a range of other risky behaviours that come with that, and there's no point in just addressing one bit without addressing the whole approach for young people. So I'm pleased that they're here, and I'm pleased that they're trying to do the job that they're doing with young people under 18 and 19. And then of course you get into adulthood, the clinical line of adulthood at 18. So from 18 to 25, those people would go into our adult services. So that's called CGL, Change, Grow, Live, and I commission the services. So part of my job is using the public health money to commission and buy the right services to help people get well. So as well as having all the strategic responsibility, I've actually got the checkbook to buy all the things to do the right thing to get people well. So if you're 18 to 25, you'd be signposted to those services for adults. So I think it's quite intriguing, because I think when we talk about young people, different people have different age understandings. One of the things I think that was quite critical to us in Warrington is about offering support for children and young people who are affected by somebody else's substance misuse, because I think there's one bit often when we talk about substance misuse from young people, we're expecting people to be large and get on a very overwhelming scale, and that's not the case. We would have young people in this borough whose parents might be using alcohol a lot, who might be seeing domestic abuse because of alcohol, who might be affected by parents using drugs, for example, and there's a bit about how we support them. So we've just commissioned a one-year piece of work with one of our services to look at the hidden harm, that's the phrase we would call it, the hidden harm effects of young people who are affected by someone else's drugs. I'm really pleased, I guess, for us, because there's only 2 other local authorities that have got that quite clear focus around hidden harm across Cheshire and Merseyside. So we're doing quite okay. When I first came to Warrington in 2008, I'm trying to think that far back, of the 22 Northwest local authorities, Warrington was the worst performing. So we have a whole range of indicators that the Department of Health assesses by. And so we were the worst in the 22 Northwest local authorities. And by 2012 we were the best of the 326 local authorities nationally. So that's my big claim to fame, that I've hopefully got some skills to turn services around and make them effective, because this is only as good as people's behaviour changing and their drug or alcohol patterns changing.
How effective have these services been in treating drug addictions or the harmful effects of drug use among young people?
For Warrington, it's quite interesting. We've not seen some of the epidemics that have been happening nationally for young people. We don't necessarily have a city culture here. Warrington is placed between Manchester and Liverpool, so I guess they're the 2 major cities that have got the big young people. Maybe our young people may go there to experience their social life and their nightlife. So for our young people here, the main drugs will still remain cannabis, and that's quite a big open-ended conversation when you're talking around the different strains of cannabis that there are available, and alcohol. The quite intriguing bit we have is that the alcohol isn't underage supply. Our trading standards do a really robust piece of work in checking that all the shops aren't selling underage. The big issue we've got is around parental supply, and that's a piece of work that we're looking at with colleagues over the next year to do some campaign work, for want of a better phrase, around parents supplying drink to their children within the family setting. From a drug pattern, we get odd bits of cocaine, but nothing else at all. Certainly in the 10 years I've been here, I think we've probably only had 1 or 2 people presenting with heroin, and they've obviously been at the top end of 17, 18-year-olds, so they've been supported clinically through our adult services. So it's quite an interesting drug pattern. So when you go to the other age of the 18 to 25s, we have got some men who inject steroids here. That's quite an interesting bit for us in Warrington. And we offer a range of support services, because obviously when you come to injecting drugs, as opposed to smoking them or snorting them and sniffing them or drinking them, when you come to injecting, that comes across with bloodborne viruses and sharing needles and all of those things that we're trying to not let happen. So maybe a bit later on I can talk about some of the harm reduction stuff that we're looking at there. So certainly I would say for under 18s, 19s, cannabis and alcohol are the 2 main bits. We're getting very few, I think probably over the last year, probably 80 new people under 25 coming into our service, our adult services. Some of those might be offenders because of the nature of the drugs and alcohol and offending behaviour. One of the other things I forgot to mention earlier on was I also commissioned the substance misuse services in the 2 prisons here in Warrington. We've got Risley and Thorncross Prison, and Thorncross Prison's got a cohort of under 25-year-old men as well. So we offer the similar sorts of services that we have in the community as at Thorncross.
Since you began in your career, have you seen a significant rise or fall in the amount of young people using services offered by the council for substance abuse?
Since I began last century, all those years ago, I think it's different. I don't think it's a rise or fall. I think it's just different. So when I first came into this area of work in the back end of the 90s, you still had bits of MDMA, ecstasy knocking about. Still had that back end of the Manchester model, I guess, and the partying time. Young people, alcohol I think has been quite consistent for young people through all of that. One of the different things certainly in the 90s and the early 2000s was around glue sniffing and aerosols and all of that usage that young people would have. I don't see that now. There's obviously the whole thing of new psychoactive substances. Legal highs is sometimes what we call them, although most of them are illegal. Let's be clear on the law. But here in Warrington, our young people aren't really doing that. The issue with NPS we've got is a group of characters who have been long-term heroin users who turned to spice predominantly because it was cheaper than street heroin. So the NPS conversation has been very much focused on that age profile. So I think the dilemma is with drugs in the old days, probably of the 90s and the 2000s, it was all very much your plant-based drugs. So your heroin obviously comes from poppies, cannabis plants, cocaine comes from the cocoa plant, of course. The bits now, some of them are manufactured, and the risk is for young people as well as for older people, and particularly when we're talking about club drugs, you don't know what you're getting. So people never know what they're buying and they never know what they're ingesting. And it's a bit like baking a cake. I often say to people, if you're manufacturing drugs of this nature, I might put in some eggs and some flour and a bit of cocoa and make a lovely chocolate cake. Your recipe might not include cocoa, but might include coconut, perhaps. So, but we both think it's a cake. And the dilemma with some of the drugs that young people, and I know people, but young people in regards to this piece of research are buying, they don't know at all what they're taking. And I think that's a real risk and a real dilemma. And I think the other big thing that's on the horizon is internet sales. I think in the old days, you would have street drug dealers, rightly or wrongly, by the nature of the law. Most users would know what they were getting. People are buying stuff off the internet now, and they come with real risks because people don't know if they're buying Xanax, for example, or if they're buying spice, for example, off the internet. They just see the logo. Most of these manufacturers aren't your major suppliers like Amazon and Boots. They're self-created websites, and I think that's, as we move forward, when we look at drug patterns and drug usages, I think that's going to be the ill-harm effects of internet drug supply. Will be a big issue, I think, for young people.
Many organisations have now had to change their approach to young people who use drugs by introducing services such as drug safety testing as a way of preventing harm through drug use. Is this something yourself or the council have considered, or what are your thoughts on this method of harm reduction?
The council haven't introduced it because we would normally follow the government policy, and I've not seen anything certainly to say that we would need to have a real look at that. I think most of the drug testing has happened where there's been festivals and big major events. I think that it's an interesting one, isn't it? Because I guess drug testing can only be done if you know what you're testing for. So some of the drugs that are around the new psychoactive substances, for example, some police forces nationally were struggling to test for NPS to find out what the constituent parts were because they didn't know what was in them. So the drug testing process around, do we test for A, B, C and D, and an organisation might come saying we'll test for A, B, C and D, but what might be in a particular tablet or a particular powder might be X, Y and Z. So the drug testing process isn't effective. I think as a methodology for harm reduction, I think there's something potentially in it, but I think it needs to be a bit more robust. I think often some of the more continental countries, Holland and the Netherlands, I think have had a much more advanced drug testing than we have had here in the UK. The question for me is about you're testing for what, and are the processes for positive testing robust to be able to inform young people appropriately that this is what they've got in their powder.
Do you think that mental health services are up to date with how to treat young people suffering mental health issues due to substance abuse?
No, is probably my word. Professionally, I would say no, not at this point in time. I think the struggle has been the major cuts across mental health services, both for young people and adults. I think there's often, particularly around mental health and substance misuse, we call that dual diagnosis. So when people present with both of those things, the dilemma is often in mental health services, it's a bit like the chicken and the egg. Mental health services will deal with somebody's mental health providing they're sober or clean, and that happens in the adult world as well, not specifically for young people. So I think it's about a systematic approach to mental health. So people, for example, might be referred, and the view might be that they're using drugs or alcohol to mask the issues that are impacting on their mental health. But mental health services might say, we're not going to deal with that until they're sober or clean. And so the window of time for opportunity for working with a young person then becomes longer and longer, because obviously then they're dealing with trying to reduce their drug or alcohol intake to make them well, to go to a mental health service. I think there's still a lot more to be done. So whilst I might have been brutal in going no, I think there are odd bits of good examples, but I think certainly strategically when you talk about dual diagnosis, that marriage of substance misuse and mental health isn't as robustly coordinated as I think it should be.
How does the council liaise with local mental health services to try and improve treatment for young people who suffer due to the implications of substance abuse?
The council don't commission the mental health services. I think that's the dilemma in some ways for us. So that's commissioned through the clinical commissioning group that used to be the primary care trust. So it's very much a health offer. In saying that, what we have here is quite a robust group of meetings and meetings with key individuals from the CCG, that's that clinical commissioning group, to talk about the impacts of mental health and substance misuse on young people. So I think the conversations are there, that the opportunity to change the contract and change that specification sits with the CCG. So I think there's still, again, some bits of work that we would need to enhance from a council perspective to try and get that right for young people.
Does the council have any targets or aims within the next few years in terms of reducing harm through substance abuse?
Oh yes, we have lots of targets. I think that would be fair to say. So all our targets nationally come via the Department of Health through to Public Health England, and we've got lots of reporting that we have to do. And we're judged by local authority against that performance. And then we have our own in-house borough targets of things that we want to do. I think there's a difference about targets, because that for me is about the numbers game. We've had 42 in this month and 19 in that month. That just tells a bit of a story. I think what's important for me is about the outcomes. What are the right things to do for young people to help them either change behaviour or help them get well? And that's the important bit. And sometimes that can't be the numbers game, because that needs a bit more gumption in working with partners to help change some of that bit. So the bit ideally, and I say this quite often in Warrington, is to make myself and our young people's and adult services out of a job, because I would like everybody in Warrington to not take drugs and not drink and not cause themselves any harm. Obviously that's not going to happen, as much as that's still the dream. And so we need to have in place real information and robust information. There's no point saying to young people, drugs will kill you, because smoking kills you, for example, and there's some quite clear evidence. There is evidence to say some drugs taken inappropriately or injected in the wrong way, or imbibed differently, will cause death, and nobody's disputing that. But there's a bit about how we give people really robust information to give them the right choices to make some decisions. Similarly with alcohol, although much more health evidence would say alcohol consumption in young people does lead to quite chaotic behaviour and uncomfortable behaviour as you get older. So there's a bit about how we inform, again, young people to help them make their own choices. and hopefully don't see them in our adult services. That's the real bit. When we talk to some of our people in adult services, they did start drinking and taking drugs in their teenage years, very early teenage years for a few of them. And that's because something happened in their lives. So going back to what you were saying before about the mental health issue, a couple of them have really said to me, if I had known now what was available, then I wouldn't be where I am now in the service, drinking 2 bottles of vodka a day to mask an issue of seeing somebody get knocked over when I was 15. So there's a bit about people, I suppose, self-medicating when they're younger because they don't know where to go. People aren't sure about where to send young people for some support and some help. And so on occasion they could go through the net. I think one of the real opportunities we have here in Warrington is offering an early help offer to try and get that early doors, and so we don't see people falling through the net, but more importantly, don't presenting as adults into our services.
Yeah, perfect. Thank you.